Treatment of acne or rosacea, or both of these conditions, is often required as a combination therapy as opposed to monotherapy. Combination therapy may include topical agents, which may be prescription or over-the-counter, oral agents such as oral antibiotics or vitamin A derivatives, and procedures that you can perform in your office, such as laser treatment or light treatments. For each of these conditions, for acne and rosacea, it's important to approach each patient as an individual to see if monotherapy would be okay for this patient or if they would require combination therapy to improve their condition, not only to improve it, but also maybe improve it more quickly. So it's very important to approach each patient as an individual and really see if monotherapy versus combination therapy would be appropriate for that particular patient. As we all know, acne vulgaris is the most common condition treated by dermatologists. Now, this condition is increasing in number due to the fact that more patients in their adulthood continue to suffer from acne. In my personal practice, the adult female patient is the most common patient that I see in the office. The approach of therapy for this particular patient type can be either monotherapy or combination therapy. In my experience, I find that most patients require more than one treatment modality to improve their condition. And that is not only because you want to treat their acne, but a lot of patients are concerned with sort of the after effects of acne, whether it's hyperpigmentation, acne scarring, persistent erythema, enlarged pores, and etc. So for each acne patient, individualized approach is very important. Topical agents may include vitamin A derivatives or combinations of antibiotics and benzoyl peroxide, depending on the type of acne that they have. Oral therapy may also play a role, such as with oral antibiotics or vitamin A derivatives, such as isotretinoin. I also think that over-the-counter treatments are very important. A lot of patients want you to give them an idea of what kind of moisturizer or sunscreen or wash or toner they should use to treat their acne or to not make their acne worse and really try to make it better. For adult female patients, it's also very important to discuss makeup. A lot of times the type of makeup that the patients may use may actually be clogging their pores or making their acne worse. The other point about makeup is the color or the tint of makeup can sometimes help them cover their blemishes, help them not only cover the pimples and pustules, but also the after effects, the pigmentation, the persistent erythema. So we actually go through their entire makeup regimen at each visit, or especially in the beginning when they first come in, to make sure that they're using the right makeup. I also use physical modalities or treatments that we can do in the office for patients with acne. And this includes lasers, this includes light sources, and a combination of all of these approaches really takes care of the entire patient, not just their individual pimples. So I really think discussing this, especially in the beginning when you're first seeing the patients, about all of the treatments that can be done to improve their condition is very important. Joe Urizzo is one of my mentors in residency. He used to always say that when you tell patients at the first visit is patient education, and what you tell them at follow-up is an excuse. So I think it's very important to kind of set the bar straight from the beginning, discuss all the possible treatments that you can use, and really move on from there. Another topic that's very important to discuss is potential hormonal abnormalities, especially in patients with adult female acne. So oftentimes we'll ask the patients about their menstrual history, their menstrual cycle, to make sure that there's no other evidence of hormonal abnormalities. Conditions such as alopecia, increased hair, hirsutism should point you in the direction of need for a workup for hormonal abnormalities. And in my personal practice, I work with an endocrinologist and really refer the patient to the endocrinologist to see if the hormonal workup is appropriate, have it performed, and if there are any hormonal abnormalities, to then have those treated. Rosacea is another very common condition treated by dermatologists. I think it's really important to treat each rosacea patient as an individual because each patient may have different attributes or symptoms of rosacea. Papules, pustules, erythema, telangiectasias, flushing, all of these are very important in each patient individually. So when I see a rosacea patient, especially for the first time, we try to really break down their symptoms. So we discuss what kind of treatments they can have or they may get for their papules and pustules, and what kind of treatments are available for their overall appearance, which includes flushing, erythema, and telangiectasies. So for papules and pustules, there are multiple topical agents that can be used, including azelaic acid preparations, including topical antibiotics. There's a new topical anti-mite medication that was just recently approved, so you really have to tailor the treatment to that particular patient. For patients' erythema, flushing, telangiectasies, we really discuss more of procedures that we can do in the office, as well as a current topical agent which is approved for the patients to use for flushing and erythema. So it's really a combination approach, and that's an approach I take for most patients with rosacea. For patients with papules and pustules, it's also important to discuss oral agents such as antibiotics or vitamin A derivatives, and light-based devices can actually help both erythema, telangiectasies, and some papules and pustules for some patients. I also think it's very important to discuss their OTC, their over-the-counter products that they may be using. Sunscreen is of vital importance in every patient with rosacea because we do know that UV causes flares or can cause flares of their rosacea. So every patient gets counseled on using sunscreen. We talk about what kind of sunscreen they can use. Really, what they can try and see what really works for them. Gentle cleansers and washes are important. Using a moisturizer is very important. Perhaps one that has a barrier function repair built in. That's also something that we should discuss with every single patient with rosacea. Discussing triggers of acne and rosacea is very important with patients. I will often ask the patients what they think makes their acne or rosacea worse. Stress is probably the most common answer that I get from patients, so it's very important to discuss the fact that stress may exacerbate their conditions. For acne patients specifically, I think topical agents that they may be using, such as makeup that may clog their pores, are also something that could trigger an acne flare. Hormonal abnormalities may trigger acne flares, and foods are something else that patients often talk about. For rosacea patients, it's very important to discuss the triggers that may make their rosacea worse, and really trigger avoidance is very important. So things like UV exposure, hot beverages, coffee or tea, or foods, different foods that make rosacea worse. It's very important to discuss those with patients. So for both acne and rosacea patients, I will often refer them to the societies that really function as a support group for each of these conditions to see what other patients think makes things worse, and really to get a credible source of information for things that they can be doing to improve their conditions and to avoid flares. I think UV exposure is a very important topic to discuss with both acne and rosacea patients. We do know for a fact that UV can trigger rosacea flares. Now for acne patients, a lot of times patients will say that when they're exposed to UV, their acne actually gets better. So for me, it's an opportunity to really counsel them about the risks of skin cancer and other things that can happen from too much UV exposure, such as wrinkles, hyperpigmentation, but really skin cancer is where we focus, to sort of try to steer them away from getting UV as a treatment for their acne. In conclusion, for both acne vulgaris and rosacea patients, it's very important to take each patient as an individual and evaluate the patient to see if monotherapy or combination therapy would be appropriate. In my experience, combination therapy, which includes over-the-counter products, in combination with prescription products, and perhaps things that you can do in the office, such as light-based devices, really works the best.